Hi everybody, Chris Munn here. Today is Sunday, November 8th, and it's time for another COVID update. Again, we're going to be looking at an article on the Hudson Valley Observer. What is the Hudson Valley Observer? It is our new online newspaper. You can find it at hvobserver.com. It is a not-for-profit, and our official 501c3 is pending from the IRS. We're covering Red Hook, Milan, Hyde Park, Clinton, and Rhinebeck. That's the same footprint as my old newspaper. And we do take donations at our website, which will be tax deductible depending on your tax situation and your income situation, of course. Also, you should know that my time on this is 100% volunteer. I take no money from the not-for-profit. We do pay our reporters. And anybody who's interested in volunteering, please let me know. Or if you're interested in writing. Now, that said, if you find this interesting and you want to see more of it, please share, click like, leave me a comment. If you have any questions, please don't hesitate to ask. So let's go look today. So today we just posted a new article up here, and it is 51 new cases on November 7th in Dutchess County. So that is really the highest total since May, I'm pretty sure. I mean, there was one day that 138 got registered, but those were leftovers from an adjustment from previous. But I think in terms of new cases, that's the most since May, and it's been a long time. Looking at where these cases are, we do have every day the full list of every town and village with the number. So on the Dutchess County dashboard, they don't necessarily have the ones and the twos, but you can see exactly how many cases. For example, in Pine Plains, it shows there's one. Not the old less than 5 that you see. If a town or a village isn't listed here, that means there's no cases being monitored by the county there. Now remember, this doesn't mean that nobody has COVID there, right? We need to remember that just because you haven't been tested or tracked by the county doesn't mean you can't have COVID. So it could be in your community anyway, especially now as things ramp up. So we still have to be careful, even if there's nobody in our specific village listed here on this page. In terms of schools, we have some more positive tests in the schools. We have one more positive test at Hyde Park Central School District. We've got 2 more positives in Arlington. And as we scroll down here, 2 more positives in Wappinger. I actually didn't notice that until just now. 1 positive in Beacon. And looking down here, we did get our first positive test at Bard College. It's just 1. I think that they're testing everybody before Thanksgiving break, but I'm not sure if this is part of that big sweep. But they did have their first positive test actually the whole semester, which is pretty amazing. The other colleges had many more. Marist College has a big cluster. They had 10 more positive tests come in yesterday. And they had 20-something the day before, I believe it was. And then Vassar College had 1 positive test. So we can see clearly that, this is picking up steam. I hope this is an aberration. I mean, we all hope, right? I'm not cheerleading the virus. We don't want this to happen, but, this curve does not bode well at this point. Even if you take out the Marist cluster, just in the last 3 or 4 days, we've had 150 or so positive tests, and that's not all Marist. That's not even mostly Marist. So we need to, keep up our social distancing, wear our masks, and so forth. And I wanted to talk about one other thing today is that I've read online, I've heard maybe some of your friends have tried to tell you that, people are not dying from COVID, they're dying from other things. And I mean, obviously for many of us, that seems ridiculous on its face, but, some other people, believe otherwise. And it's been disproven. And I understand what you're saying that, someone who has cancer and then gets COVID and dies, and then they died from COVID, that this doesn't seem to make any sense. But in the comment section, somebody mentioned, if you have cancer and you're in a car accident and you die from trauma. The cancer didn't kill you. And the same way, if you have cancer and you get COVID and you go on a ventilator and you die, it was because of COVID. you may have had some other sickness, and we're all dying slowly, hopefully not for many years, but to try to suggest that you're not actually dying of that. And one of the ways we know this, it's not just me saying this, right, is there's something called excess deaths, right? So every year the number of deaths in the United States are pretty consistent, and you can look from year to year, and there's a tiny bit of variation, but not all that much. So when something like this happens, you can take the number of recorded deaths, regardless of cause, and just add them all up, and then subtract them from the number that you think it should be based on what it was the year before that, and the year before that, in similar years. And they've already had done 2 studies on this in the United States, and they just did it from March through July, and I'm just looking at the notes here. The 5-month period from March through July, there were 225,530 more deaths than expected. And that's more than the number of COVID deaths that were reported, which makes sense because remember, we didn't have a lot of tests up front. We didn't know who had it. And a lot of people died, perhaps, in their apartments in New York City or wherever, and they never got treatment and they never got tested because there weren't enough tests to go around at that point. So 225,000 died more than would be expected between March and July. So that, and if you had cancer and you had 6 months to live or a year to live, or perhaps you would have gone into remission and then you died, you didn't die from cancer. You died from COVID, if that's what you caught, and the complications from that caused your death. So anyway, that's just something that, it's been jumping around, and I know I'm not going to convince anybody, but perhaps if somebody brings it up to you, you can point out that, if you just add up all the deaths, all the people who died this year, subtract it by how many there should have been, there's a couple 100,000 people missing that, otherwise would still be alive, according to the numbers. So, and that's COVID. So let's be careful out there. Let's make sure we wear our masks, socially distance, be smart about, staying clean and not putting yourself in risky situations, especially if you have, vulnerable people in your house or you yourself are vulnerable. And stay safe out there. Take care.